Dr. William Weisberg, the moderator of our second panel, has worked in the fields of youth services and conflict resolution for more than 20 years. He is currently the Chief Operating Officer of the Children's Aid Society, an organization which currently offers its many programs to over 150,000 children at sites all over the city. Dr. Weisberg has extensive experience in building and improving programs that target groups with ever-changing demographics, as well as a substantial background in conflict resolution. Our many thanks go out to him today for joining us. We were really happy when you said that you would moderate this panel. Please join me in welcoming Dr. Weisberg, who will introduce his panel.
Thank you very much. Good morning. I'm very happy to be here and to be able to introduce this distinguished panel. In New York City, there really is a lot that's quite stable. On a warm September afternoon, I'll take my kids out to Coney Island for a hot dog and a walk on the beach and a ride on the Ferris wheel, as my parents did with me 40 years ago and their parents did with them 70 years ago. We have a lot that's stable in our communities. At the same time, there's a lot that changes. As just a few examples, in our work at Children's Aid building full-service community schools in Washington Heights starting about 15 to 20 years ago, when we started in Washington Heights, they couldn't build school buildings quickly enough. The minute one was completed, it was full. And so 10 years ago, middle schools we were working with that had a capacity of 1,500 students had 1,500 students. Then 5 years later, they were overcrowded and had 2,100 students and had to have split shifts. Then the population has started to decline, so now they're at capacity going to under capacity over the next few years. So our communities change in terms of population density and the ages of the population. Also in terms of income. In Washington Heights, in Harlem and Bedford-Stuyvesant, where we also operate, the income of the average household has increased tremendously in the last 10 years. They're two of the four neighborhoods of New York that have had the highest average income growth of over 20%. And our communities also change in terms of nationality, immigration, ethnic identity. In Queens, where we work with Boys and Girls Clubs and are starting to work with schools, we know there are now over 138 different languages being spoken at homes and in schools. Each of these changes forces us as charities to re-examine what we're doing, to wonder how to keep our work relevant and how to measure its effectiveness. In an atmosphere that demands that we demonstrate effectiveness, both because we want to make sure we're having real impact, but also because funders demand it increasingly, what are useful tools and approaches to measuring effectiveness in rapidly changing communities? And we're fortunate today to have three wonderful panelists to help us explore these questions. The format will have very brief 5-minute presentations from each of the panelists, followed by a panel discussion of some questions. And then the third section will be question and answer, which we'll do in the wonderful method of the Better Business Bureau. They have great people walking around to collect your cards, and we barely notice it's going on. And so we're going to use that method as well. So as you have a question, please note it on a card and let one of the staff know. Our first presentation is from Ed Pauly, who's the Director of Research and Evaluation for the Wallace Foundation, one of the most influential catalysts for evaluating organizations' effectiveness and strengthening them. As with the other panelists, there's a bio in your kit. So I will just say that I think he's a perfect person for a panel presentation on evaluation in times of transition because he's dedicated his career to research on education, an important and always changing topic, as well as more recently on after-school and arts programming. And he's an expert on how grant makers contribute to development of effective organizations. Today he's going to talk to us a little bit about market research to start us off. So Ed.
Thanks, Bill. Good morning. I'm Edward Pauly, and my work at the Wallace Foundation is aimed at building new knowledge to support improvements in after-school programs, arts learning for young people, expanded participation in the arts, and improving the leadership of the public schools. The Wallace Foundation works nationwide, and we are very proud of our major grants right here in New York City. A consistent theme in Wallace's work with grantees is that nonprofits can serve their clients most effectively when they have good information on what their target groups want and need. Now, this is an old and an honorable tradition in the nonprofit sector, as you know well. Settlement houses were established to respond to the lack of services in low-income communities that were known to the founders of the settlement houses. Nonprofits serving immigrant communities are effective because they speak the language of immigrants and know their families well. Community-based health clinics need to be culturally competent in order to adapt to the expectations of their patients. And employment training centers need to understand the life experiences of the people who need job training. Now, language changes over the years, and now a contemporary approach to figuring out what your clients want is known as market research. Now, market research is a commercial term, but it has a meaning that cuts across the commercial and the nonprofit sectors. Market research refers to systematically gathering information about the preferences and the needs of the people your organization wants to serve so that you can serve them better. It's information for your decision making. Now, many nonprofits were started by people who have an excellent understanding of the people they seek to serve, so they may not need to do market research, at least initially. But as time goes by, and they serve more people and different people with more services, and their services become more complicated, and their funders ask for information about the effectiveness of those services for the people being served, it can be really useful for nonprofits to refresh their knowledge about the people they're serving, about their needs and preferences. As an example, 3 years ago, as part of the Wallace Foundation's work supporting after-school programs for school-aged children, we asked a group called Market Street Research to prepare a how-to-do-it guide to market research for after-school programs. It's called Getting Started with Market Research for Out-of-School Time Planning, and it's available as a free download, emphasis on free, from Wallace's website, wallacefoundation.org, and there's a flyer in your materials that gives you the URL information for the download and a brief description. Free is an important word in these economic times, and so I hope you'll be able to take advantage of that of those materials. And while this guide is tailored for youth-serving organizations, almost everything in it is directly applicable to nonprofits serving a range of other populations, so you can easily adapt it to meet your organization's needs. And while my examples today are from after-school organizations, Wallace has also used this approach for a large number of arts organizations that we support, and they've done a terrific job in sharpening their outreach, understanding the needs and preferences of their customers, audiences, and stakeholders. So the tools of market research are just broadly applicable to a very wide range of charities and nonprofits. Now, this guide that I've just mentioned covers all of the basics of market research: when and why your organization should consider doing market research, what kind of market research will be useful for you, as well as how you can do it inexpensively, even using volunteers in many cases, and how to use it once it's done. I want to give some examples of some of the market research results that have been particularly useful for youth-serving organizations. Some of the youth-serving organizations supported by Wallace to do this work have found out what proportion of the target group are people who themselves or the parents of the young people speak a language other than English at home, which really changes the way they communicate with the folks at home. They found out that many of the parents of the youth they were serving have concerns about safety issues, either safety issues in the program itself or for the kids going to and from the organizations, often on their way home from after-school programs when they end at the end of the day. They found out that many parents want more homework help to be part of the programs, and to a remarkable extent, the youth themselves wanted more homework help. They found out that there were some parents who could afford to pay at least a chunk of the cost of the services, and they got a good estimate of the proportion of the parents who were unable to pay for any of the services. And the market research results that different youth-serving organizations got were different depending on the groups that they were serving and the issues in their particular local neighborhoods. Once the nonprofits got that information, they were able to take action to improve safety where that was a need, to send parents information in their own languages, to provide more homework help where that was a high demand item, and to adjust fees to levels that parents can afford. And when the nonprofits used this market research information, enrollments and attendance went up, because the more you know about your target group, the better you can serve them. Now, the methods that are described in this guide include focus groups, interviews, informal surveys, more elaborate surveys. And the message here is there is no one-size-fits-all way to do market research. It's a highly adaptable set of techniques that you can tailor to your budget, to your staff, to your volunteers. What's best for your organization depends on your specific organization. So I hope many of you find this to be a useful resource for learning more about the people that you want to serve. So I've been trying to whet your appetite for considering the use of this kind of organization, but there's another resource that it's also worth thinking about when you think about market research, and that resource is market research that has already been done, and all you have to do is read it. Let me give an example of that. Wallace Foundation commissioned a national survey of parents of school-age children, as well as hundreds of middle school and high school-age youth, about after-school programs and what they wanted and what they felt they weren't getting. The study was done by a wonderful nonprofit here in New York City called Public Agenda. It was done in 2004. It's called All Work and No Play, ? Listening to what kids and parents really want from out-of-school time. And again, it's available as a free, emphasis on free, download from wallacefoundation.org. When you read it, you will recognize the voices of young people and their parents, because they're the voices of the young people and the parents that you serve. And you'll get lots of ideas about things that you already know, things that you may not have known, and things that you want to know more about for your constituencies and your stakeholders. You'll get ideas for what you might want to do your own market research on. Now, the point here is that you already know a huge amount about the people that you serve. You know a lot about the things that you'd like to know more about. And there are some good tools available for you that can help you get the information that you need in order to serve your target groups better. But I don't want to leave a message that this is a technological fix, or this is a set of tools that you pick up the toolbox and open it up and start applying it. More important than the tools is the question, do you need market research? And what kinds of market research questions are the ones that are meaningful, if any are, for your organization? I'd say that the most important way to think about market research is to ask yourself, what does my organization most need to learn about our clients and our target groups? Another way to ask that question is to say, what is it that we don't know about the people that we serve that if we knew it, it would enable us to make breakthroughs in the services that we provide for them? You are already far more knowledgeable about your target groups, your clients, and what your organization needs to learn than any consultant could ever be. So you are in the best position to decide whether there is a use for market research in your organization, and if there is, what you should be focusing on and what you most need to learn. The president of the Wallace Foundation, Christine DeVita, wrote a brief introduction to the Public Agenda report. She called it Heeding the Voices of Consumers. And heeding the voices of consumers is one of the most important challenges and really one of the biggest opportunities for charities today, as it was for the settlement houses in the 19th century.
Thank you very much, Ed, for those opening comments. And it's true that very often we'll get feedback from staff members, we know that parents want more work on this in our after-school programs, but to really take the time to stop and use simple free tools in order to assess that data and how widespread it is and not just rely on anecdotes is a very good message and very helpful. Thank you. Our next presenter is Rob Smith. He's Associate Professor of Sociology, Immigration Studies, and Public Affairs here at the School of Public Affairs at Baruch and the Graduate Center of CUNY. He studied and served the Mexican community in New York and Mexico for more than 20 years, especially in the state of Puebla. He's going to help us focus on changing communities by really zeroing in on one of the very important changing communities in New York, the Mexican immigrant community. And along with this great symposium venue, we think that Baruch has made a wonderful contribution to the symposium by sending us Rob. So, Rob, take it away.
Thank you very much. And I see some old friends here, so welcome everybody to Baruch. The thing I'm going to talk about today is just give a very brief, I just used 30 seconds of my 5 minutes, so a very brief overview. That was a joke. Thank you. I'm going to give a very brief overview of the Mexican community and then talk about some of the issues in the community I think might be things that would affect nonprofits' interactions with them, and then I'm going to make a pitch for some very excellent after-school programs. But the Mexican community in New York, most people, when people learn that I've spent a long time studying this, if they're from out of town, they say, "Oh, I didn't know there were any Mexicans in New York." And if they're from in town, they say, "Yeah, where are they all coming from?" And how many of them are there? There's over 500,000 Mexicans in New York City now, and there's over 750,000 in the New York, New Jersey, Connecticut area. So if you think of this is one in New York City. It's 1 out of every 16 people is Mexican now. And the other piece of this is that it's not going to slow down, right? There's about 600,000 or 700,000 Dominicans, but there's only 8 million Dominicans in the Dominican Republic. There's 110 million Mexicans, and increasing numbers of them are coming to newer parts of the United States. This is part of a larger spreading out of migration from away from the Southwest to other parts of the country. And so I think, places like North Carolina and Georgia and places like that have experienced a huge increase in the numbers of Mexicans as well. Now, one of the biggest facts about the Mexican community in New York and the region is that there has been basically a de facto moratorium for the last 20 years on allowing recent immigrants to get legal status unless they come through unskilled laborers to get legal status. So since the amnesty program of the late 1980s, basically if you've come in the last 20 years and you're a recent immigrant, unless you have pre-existing family connections, you have like a 90-something% chance to be undocumented. And this is not just an anecdote. We did a large survey in a variety of public places, and 93% of the people who had been here less than 5 years were undocumented. Now, one of the things that and there are also increasing numbers of people who speak Spanish as a second language, whose first language is an indigenous language, although this is still a small percentage of the population. One of the things that goes with this territory of having such a large percentage of your population, probably over half of the whole population, including Mexican-American citizens and legal residents, is that this high percentage of undocumented status leads to a tremendous amount of fear and the circulation of a tremendous amount of misinformation. And I've worked with the Chancellor's Committee on Mexicans and Education in New York City. One of the things that we found in research I did there and with Baruch was that most people believe that undocumented people can't go to college, which is not true, in fact. You can actually go under many circumstances in New York. I've done outreach to guidance counselors, and 90% of them didn't think undocumented people could go, and they'd been misadvising their students. There's also a tremendous fear that if you go to a service agency for a problem, your children will be taken away. And there are, in fact, cases where such things have happened, right? They don't have to have a lot of these cases before these ideas spread. So one of the things I would urge people to do would be to develop trusted relationships with community organizations and people in the community, and try to find out what these stories are that are circulating. Or you can hire Baruch professors and their graduate students to help you with this kind of work.
Is it free?
It can be free, yes, for worthy causes. There are some other things that I think are very interesting to keep in mind is that not the Mexican population is very internally varied. So you've got a large number of undocumented people, but in that population you've got undocumented adults. You've got kids who were born in Mexico but raised in the United States from a very young age, say, before first or second grade, so they're basically Americans, but they're still undocumented. And then their lives come to their progress comes to a screeching halt at the end of high school when they realize, or they think they can't go to college, or after they graduate from college they can't get a job. There's also a large number of U.S.-born Mexicans now and legal residents, and those groups have different needs, and this would be the case for other groups as well. I think, and this is the final thing that I'll say, because I'm in minute 7 of 5 minutes, I think now, or 6 or something. one of the things about this community, and it's not unique to the Mexican community, but it's perhaps even more important because of the size of the community, its potential for continued growth, and the particularities that go along with having such a large undocumented population. The Mexican community is internally very densely organized. Everybody belongs to a community of origin committee, sends money back, belongs to a local prayer group or something. There's very few people who are completely isolated. However, and there are many, many Mexican institutions, organizations. However, very few of these organizations are linked up with American institutions or organizations such as yours, right? So that in fact, this organizational capacity in the community not actually being used to help deliver services and to disseminate information. Right now, at CUNY, we've been trying to help remedy some of that. But it's a thing that I think would be useful for funders and nonprofit people such as yourselves to think about, because we don't have to reinvent the wheel to solve and address a lot of these problems. Right, the problem of people thinking you can't go to school when you're undocumented, we can fix that problem partly by actually just disseminating the information and developing the relationships with the community. So I would invite you guys to think more about that. And there are, in fact, a number of very, very excellent after-school programs that are helping to do exactly the sorts of things that Ed was just talking about, of linking up, helping to develop links between the schools and the community groups, and helping them with homework, helping them to find out about how to go to college and things like that. So, the good news is a lot of the things you guys are already doing can be replicated in these ways, but it's going to take this sort of bridge-building work to get it done. So anyway, I'll end there without.
Oh no, thank you, Ed, and a lot of good information there, including, again, the importance of knowing your community, because often there are these community myths, like ability to go to college, that if you know the community and you know what's out there, it gives you the opportunity to find correct information and disseminate it. And we found great partners in our work with immigration lawyers committees that have gone out and informed people about rights. I think we've also found out that there is free research available from Baruch faculty and students, but it's for the right price. And our last presenter is Chung-Wha, who's the executive director of the New York Immigration Community. And those of us in the field know that the New York Immigration Coalition, which is a group representing more than 200 organizations, is one of the most effective and vital advocacy groups in New York City. And Ms. Hong is clearly one of the reasons. Probably modesty prevented her from putting in her bio that you have that she was named one of the most influential people in politics from New York Magazine. And she was also named one of the 100 most influential women in New York City business by Crain's, where I came across my favorite story about her, which is that she worked so hard after 3 days of around-the-clock work and exhaustion, she was physically collapsing to the floor as she grabbed a stack of things and told her colleague, "This has to go in the mail today." And it's that hard work and dedication that makes it. And she's going to help us by also linking to the prior panel how to use evaluation techniques to actually accomplish some advocacy goals. So thank you.
Thank you for embarrassing me.
My pleasure.
I think it was actually a funding proposal or something that had a deadline. I'd like to thank Claire for organizing this wonderful conference, and Dean Birdsell for hosting this. I think we really need more spaces like this to share information and trigger creative thoughts to become just better organizations and better funders and so on. So I'm going to take Ed's advice and start with a few statistics about our community, which I think is very disturbing. You know, a lot of us are very familiar with the racial disparities and so on, but I think in America there's emerging what I think is a greater disparity, is a convergence of racial and immigration status, what I'm starting to call the immigration divide. Let's look at healthcare. Non-citizens are more than 3 times likely to be uninsured than citizens. 3 times likely to be uninsured. Non-citizens are also 3 times more likely to live in overcrowded housing. and 62% are more likely to live in dangerous housing conditions. And for kids who don't speak English, who are called English language learners, their 4-year graduation rate is 23%, which is a huge difference from the regular graduation rate, which is not so great, which is 62%. So 62 versus 23 is a huge gap. More than half of the children, public school children, come from immigrant families, and 60% of low-income children are children of immigrants in New York City. And one of the most astounding facts, if you don't speak English, or let's say, I always get the order mixed up, 60% of those who don't speak English are under 200% of poverty line. So 60%. Which is an interesting link between your language acquisition, and in many cases they probably have immigration status problems too. So when we look at measuring immigrants, we have to go beyond kind of just income and just kind of the regular socioeconomic status indicators. We have to look at language. We have to look at when they came. Did they come during the last 5 years? About 1/5 of immigrants have come since year 2000, or did they come, 15 years ago? Do they have legal status, undocumented, or is it mixed statuses? What are the conditions like in their home countries? All of those things go into the matrix of trying to measure, first of all, what are the indicators, and then measure progress. So I wanted to just put the whole measurement question into perspective. So my first slide talks about, I think one way there's kind of the outcome indicators like housing, health, and income and so on. But I think it's really important to look at, when we're looking at the immigrant community, what are the lenses through which we're going to look at how immigrants are faring. How are we going to change their situations? What are we going to need to change their situations? And I think it's really important to look at 4 things. If we're looking at, let's say, immigrants in New York City. And that is, to what extent do they have equal or full access, rights, opportunities, and resources? So a city like New York, Mayor Bloomberg has done a fabulous job on the access issue. He's passed 2 executive orders that really directly address language barrier and the fear of deportation. Super. However, there's a lot more that could be done around resources or rights or opportunities. So it's kind of a mixed bag. And so in trying to evaluate how either a certain agency or certain government or how a certain community is doing, I think it's really important to look at all of those 4 lenses and see if immigrants have equality or have full access and so on. So in the next slide, I wanted to just, because this is such a big universe, I did want to pick out the issue of access, because I think that's just critical, because we're just so far from having immigrants having equal access. And as I mentioned, there are 2 major barriers to immigrants having equal access to services or to programs. One is, or let's say two barriers. One is kind of the legally kind of defined legal exclusions. Which just says if you're a legal immigrant or undocumented, you just will not have access to these programs. So we can't do anything. That's not an access issue. That's an eligibility issue. But let's say you are eligible for, let's say, food stamps. Then why aren't immigrants accessing those programs? Because number one, fear of deportation. Because even if your children are citizens and eligible for food stamps, parents are worried that some relative or they themselves might get deported. And then second is language is another barrier. So those are the 2 big access barriers. And I wanted to just share a little example of how we measured the particular language access barrier and how we use that as an advocacy tool to really change the system, change the way that the city interacts with immigrants. And so, or let's say the healthcare system. So the next slide, the one after that. Sorry, I'm going to skip one. So we looked at language access at hospitals to see how things were in terms of language access. So maybe we should look at the next slide. Anyway, whatever the slide says, we there we go. There's some information. Now the problem, I didn't foresee this problem of not being able to look at my own slides. All right, so what we did was we took surveys at hospitals before and after we passed a statewide language access regulation. So in year 2000, thank you. The BBB staff are so excellent. So we surveyed 10 hospitals, 617 patients, and like Ed said, we asked for the exact thing that we wanted to know. Does this hospital have translated signs? Does this hospital provide translation services? So if you look at the next slide, you will see the difference between before the policy and the after policy. And two examples. Before the language access statewide regulations, 0% of the hospitals had signs saying, we speak your language, we can provide interpretation. And it went from 0 to 78% after we passed the regulations. And of course, when we did the survey that showed there was 0%, we used that to meet with the hospital administrator to say, this looks really bad. And so we were able to get them to change, so 78% afterwards. Same with making appointments. So before, the year is wrong there. 50% of the people said that they could not make hospital appointments, clinic appointments because of language issues. That went down to 6%. So whereas the first survey was a big advocacy tool showing what was wrong, the second survey really showed the progress. And so when we had a press conference releasing the findings, we had all these hospital executives who wanted to join us. And, they're the same people we had been fighting in the before stage. And so it was a great kind of using survey instruments to ask simple questions, but then using that for advocacy. So I wanted to just share that one kind of measurement experience. And then in the end, that language access work developed into a citywide executive order so that now language access is integrated into the entire, the mayor's administration's whole customer service initiative, so that together with wait times and, response rates and so on, language access is put into the matrix of the customer service evaluations, and agencies get evaluated on that, and it's part of the mayor's management report, MMR, every year. And so in terms of implementation and enforcement of so many policies that we work so hard for, it guarantees that the operations part of it will continue to happen.
Thank you very much. I just love to hear how fairly simple, straightforward evaluation can be used to really change policy and practices in a positive way. I remind people, if you have questions, we have time for a few of them, so please hand them in on cards. But one question, as you described what you were doing in this hospital access survey, you did two waves, one to find out what was happening first, and then to see how changes in practice were having an effect or not. Now, when people come to me with research ideas in my agency, they're often million-dollar research ideas, and there are a lot of smaller charities in the room today. Did you spend $1 million on this evaluation of hospital access?
No, we didn't. We worked with 3 community groups. I think we gave them $5,000 mini grants, and so each community group would go to a hospital and survey, 50 patients, go to the waiting room. But then because we worked with 4 or 5 different community groups, it added up to a sizable sample. So it's not, we never say it's scientific or anything, but it does convey the real life experience of a waiting room at a hospital. So I can't remember the total funding. I want to credit and thank Robert Sterling Clark for funding this project. It was under 100,000 and was made up of very small mini grants.
Thank you. We have a lot of good questions, and we'd had some before, but let's start with some of the audience questions. And one is for you, Ed. Well, I'll put 2 together about market research. How do you incorporate, or do you incorporate, outcomes focus when conducting market research? And do you recommend market research for funders? And if so, could you give an example?
Well, on the second question, on market research for funders, the public agenda survey that I mentioned was the basis for Wallace's work, contributing to strengthening after-school programs around the country. So it's been enormously valuable for Wallace and for other foundations that have sought to make their work more research-based. It enables us to achieve much greater impacts when we have a really good understanding of what the problems are as they're experienced on the street. In the question of outcomes research in market research, I don't want to advocate for a particular set of questions or topics to focus on in market research, because I think there's something much more important than that, and that's for your organization to figure out what you most need to learn. Sometimes that will mean you want to go after questions about the outcomes that people are experiencing, or the shortfalls, the outcomes that they aren't getting. And other times, you'll need to look at access. Other times, you'll need to find out who's not being served, or who's considering coming to you for services and isn't getting through the door, or isn't signing up, isn't completing the enrollment process, or after they enroll, they're not coming back for services. So there's just a wide range of different questions that come up at different times in an organization's life cycle, and at different in different aspects of its community work. One of the surprises in the work that Wallace has supported for market research for youth serving organizations were the different ways that safety questions came up. Not for all organizations. There were some organizations and some communities where parents were very comfortable with the safety of the services and with the routes that their kids followed getting to and from the programs. But in other cases, the organizations were really startled to realize how many parents and how many of the kids were experiencing safety issues that they hadn't known about, and they didn't find out about until they asked that question. So the secret to having information that will enable your organization to improve its effectiveness is to figure out what is it that you don't know, that if you knew it, it would enable you to take the next step in advancing the effectiveness of your organization. And that's not a question that a consultant can answer for you. Only you can figure out the answer to that question.
Thank you. And our market research is showing that there are a lot of questions in this group about market research, but we're going to move on to another topic for a moment. For suggestions for affordable resources or organizations that can offer help in designing surveys and asking the right questions, especially around legal compliance, have any of you found organizations or know of them, whether they're institutes of higher learning or others, or coalitions you've worked with, that have found ways to access free or low-cost help in designing research tools?
We have sample survey instruments for language access in healthcare setting, for school setting, Medicaid offices, and I can't remember where they originated from, but often it helps to partner with research groups who are experts in those areas. One partner, I ran out of time, so maybe I can sneak in the last slide. But one of the one with the blue bars, Walter. One partner that we had was CUNY Graduate Center. Professor John Malenkoff did the ultimate measurement, which is we did a civic participation campaign. We contacted voters and told them to vote. We did a get out the vote. We called them, we mailed them things, and then we knocked on doors. And so he did a control study looking at people who are contacted by us and people who are not contacted by us. And the difference was a 14% higher election participation rate. for people that we contacted. So I think CUNY is a great resource. Rob, it's great to hear that you're kind of available, because and then there's organizations like Urban Justice Center, or for our healthcare issues, Academy of Sciences, people who are already kind of experts in that substantive area, so that you don't have to spend 10 hours explaining to them the context, and then they can jump right into the questions.
There's a Baruch survey unit here, which partners a lot with community organizations. If there is funding, it always makes everything easier. But it doesn't have to be, you can hire graduate students who are eager to do work that makes the world better, and it's not like private sector work. The School of Public Affairs partners frequently doing this kind of research. So, so I think there's a lot of possibilities.
I know that many of you are already using interns from the higher education institutions in the city. They are terrific for market research projects. It fits in their timeline. They've got the right skills for it. I know a number of nonprofits in the city that have used interns from the graduate schools of social work to do terrific work that really paid off for the organizations.
Thank you. We're running out of time, so we'll take just two more questions. One is La Union, a member-organized group of Mexican-American people living in Sunset Park, recently released a policy report on discrimination faced by Mexican-American students in New York City public schools. And the question is really how to form broader coalitions and work with others so that all stakeholders can come together and successfully advocate for changes. Chung-Wha, that's probably for you.
One? Mostly because I love La Union. Is someone from La Union here? Hi. La Union is one of those really dynamic emerging organizations that are part of the New York Immigration Coalition. We have 200 member groups, but one of the best ways of participating in our activities is by participating in a task force. So we have an education reform task force where La Union is a very active member, just bringing up education reform issues to inform our policy agenda. So I think they know the answer to the question that they're asking, which is there are many things that La Union could not have done by itself, but because we're working together in a multi-ethnic education task force with over 20 organizations, we've been able to have huge victories. And I'll just mention a couple. One is leveraging, the CFE funding that Lori Slusky talked about. It's a huge amount of money, but unless immigrant groups had done advocacy on it, none of it would have gone specifically toward immigrant students in English classes. But because of our advocacy, there were additional weights given, additional in the foundation formula to English language learners. So we were able to win unprecedented amount of funding, $700 million over 4 years out of the CFE money going straight into English language learners to address the dropout crisis. There's other education examples. So as a coalition person, I just can't say enough about how important coalition work is in making these kinds of systemic changes.
And it's very important for small and medium-sized charities, but also for large ones like the Children's Aid Society. There's so much more we can accomplish when we work together across coalition and with other partners. It gets us better bang for the buck. The last question is really about grant makers and charities working together. So Ed, I guess this is for you. And one is just how can they work together to accomplish the kinds of overcome the kind of valuation challenges there are. But here's one about many CBOs track outcomes based on funders' requests, and the funders get a lot of information then that's not always shared. Are there things that funders can do to make more public information that's gathered through the outcomes kind of evaluation work that grantees are doing?
I think this is a big opportunity, and it's a challenge that the philanthropic sector has largely not met. At the Wallace Foundation, 12 years ago, we started making all of our commission research and evaluations public. There are over 100 studies on the Wallace Foundation website, and last year there were 200,000 downloads of those studies. So there's a huge appetite out there from nonprofits, many of whom will never get a grant from the Wallace Foundation, for the evidence and the results and the information and the experiences that charities have experienced and that are recorded in these reports. It's extremely valuable information. So if more foundations and more nonprofits would make available, would post on their websites their experiences and their results, it can really accelerate the pace of change and improvement in the nonprofit sector. So I think as part of transparency and accountability in the philanthropic sector, making evidence of results available can really do a lot to promote the kinds of goals that we're all united in seeking, but that we don't always exchange information about. So it's something for you to raise with your funders, something for funders to consider in their own work, but we're really only at the beginning of meeting that challenge.
I'm sorry, a follow-up on the outcomes that funders seek. And I think Lori Slutsky alluded to this morning, talking about the new philanthropy and old philanthropy. And I think many of us are feeling this great ambivalence. On the one hand, wanting to do a lot of outcomes-based evaluation to demonstrate effectiveness of programming. On the other, feeling that low-income or elderly or populations in need deserve these services, even if this dance class is not going to cause this 7-year-old to go to a better college. It's good for a 7-year-old to have a dance class if she's in a low-income community. How is the funding community? And one foundation vice president who said to me, my board is insisting on all this outcomes data, but my neighbors spend $16,000 a year on each of their children for after-school activities. Why should we make you prove that art class, has to have some great, profound impact on that child's life? How do you deal with that ambivalence that I think a lot of us are feeling?
Well, I get a lot of questions about how to do outcome research from nonprofits. Some foundations, the nonprofits have been asked to do it, and the foundations are getting board questions or interested in doing it. And often my advice to them is, don't do that study. If somebody else has done the right study and has established what services will achieve good results, don't put scarce dollars into repeating that. Take the results and apply them and put the money into services. Before you put a nickel into doing an evaluation, you'd better be very clear that reallocation of resources away from services is going to produce more benefit for service recipients than putting the same amount of money into direct services. Now, there are times when that happens. If we learn how to be more effective, if we learn how to reach people that we weren't reaching before, if we learn how to get people to stick with services so they get more benefits than they were getting under old ways of delivering services, then that's a big gain for the service recipients. But if you don't have a clear vision of how the findings from an outcome study or any sort of study are going to improve the benefits for your service recipients, I would advise you not to do that study until you figure that out. That's a conversation that I think doesn't happen enough between nonprofits and their funders. But I think you should go ahead and quote me that there ought to be a high standard before charities are asked to divert their scarce resources into doing outcome studies. When it's merited, when there's going to be a benefit from it, that can be great. But if there's an unclear understanding of what the payoff is going to be from doing the study, I think that ought to be called into question.
Can I comment on that also? I'm sorry. Just one little
seconds.
comment? Okay. And also, I think some things are just obvious. It's just going to happen even without the study. For instance, I can tell you, when the federal stimulus money comes, and it's billions of dollars, we know it's going to create jobs for infrastructure. We know it's going to have money for unemployment insurance, food stamps, Medicaid, job training, and placement. Undocumented immigrants are going to have access to none of them. None of them. And so when we look at how do we shape a whole economic stimulus or economic recovery infrastructure that is going to serve all workers, we know who is going to fall through the cracks. And so I think there's a really urgent need, and we don't need a study to tell us that there's going to be 500,000 undocumented immigrants who are going to fall off, the lowest rung of the economy because they have no income supports whatsoever when they need to be part of the solution. And so I think some of the predicting things that we know are going to happen and trying to make up the part of the infrastructure that makes up for the flaws in the federal design and helps the people who are falling through the cracks. And after all, isn't that the role of the charities? And so I think there's a real urgency here for charities, for government to look at who are going to be the people falling through the cracks and what is that extra part of that infrastructure that we need to build so that it actually can be a recovery effort that involves the entire city.
Well, thank you. I think we've heard important things about getting to know your community, using free tools to help accomplish that. And at the registration table, we wrote up 5 websites that have a lot of data about communities in New York City. So please pick one up sometime today, because we like free tools, about partnering with people, and also about focusing our questions. One of my favorite characters that Lily Tomlin used to do said, "I always knew I wanted to be somebody, and now I realize I should have been more specific." And I think in that same vein, when we do evaluation work, if we want it to be effective, we have to be focused, as we've heard examples for conducting advocacy or market research on after-school programs. The more focused we start, the less time and effort is wasted. I want to thank our panelists in the Better Business Bureau. Thank you for all your information.